Arthrofibrosis is something many have never heard of, but it can affect healthy people of any age. Today, we're learning more about the signs and symptoms of arthrofibrosis, as well as the advanced treatment program at Mercy Health.
My name is Frank Noyes, MD, and I'm an orthopedic surgeon, and I specialize in the knee joint and disorders of the knee joint. And I run the knee center here at Mercy Hospital. And I also run the Arthrofibrosis Center that we're talking about today. Arthro means joint and fibrosis means scar tissue. And arthrofibrosis means excessive scar tissue. And what happens, and I have a knee joint here, what happens with excessive scar tissue is very simply, you can't move your knee or you have a limitation of motion. It comes in a very mild form where you can't get your knee fully straight. It comes in a moderate form where you really have a tremendous loss of motion, and in the severe form, your knee is almost completely locked. It's a very disabling condition. There are more than 1 million total knee joints in the United States every year, more than 300,000 ACL reconstructions, and anywhere from 5 to 10% of those will have excessive scar tissue that occurs in the healing process. The body puts down scar tissue when it should not put down scar tissue. And I will say, for anyone that has any surgery on the knee joint, you want to get your motion back within the first 6 to 8 weeks. Many times our patients that come from all over the United States may have had some fault, maybe not their own, where they haven't had that really good therapy, or they haven't attended it twice a week, and so they start ending up with some limitation of knee motion. If we can treat that limitation of knee motion and that stiffness within the first 3 months, we can usually get all of it back without doing surgery. There are 4 principles on the treatment of arthrofibrosis. The first is to try to avoid surgery. Again, that's where we see the patient very early. Secondly, if the arthrofibrosis has already formed that scar tissue inside the knee, blocking motion, and we do have to remove it. Removing it by an arthroscope is the easiest way. Again, if we get it early, we can use a scope. Unfortunately, at a year, we have to make small incisions into the knee, but we still use what's called minimally invasive surgery. The second part is therapy, and therapy is critical, and you really almost live with a therapist for 2 to 3 months doing very gentle stretching to now regain your motion. And the third part is medicines. There are definitely new medications that we will prescribe. Many of them are rheumatoid-like medications, and that will block the scar tissue from coming back. One of the most unfortunate things is once you get excessive scar tissue in the joint, you're probably not going to have a normal joint, particularly, for example, at a year. Not the early cases, but the late cases. So we can remove the majority of the scar tissue, but one of the big problems is once that's turned on, there's at least a 25% chance that scar tissue is going to come back. One of the big problems with arthrofibrosis is you go in to have knee surgery, you want to return to athletics or recreational activities, and now you come in with a stiff knee, you have trouble going up and down stairs, it can hurt, it's painful. And so once we get that scar tissue out and we go through months and months of rehabilitation, we can get what's called a B knee, maybe a B minus knee, but we don't get that nice A knee that you usually get with surgery. So the bottom line is, if you have any restriction in motion after surgery, you need to be in a special program that's got these experts, and we have some of the finest physical therapy and athletic trainers that are involved in our center that can really lead our patients through a very good post-operative course and not develop the complications of arthrofibrosis. Don't wait. If you have restriction in knee motion, you need to be in a therapy program. You need to be seen all of the time. If you have knee surgery, you want to be working with your therapist that next week, right after surgery, and don't give up. And if you have limitations of motion, you want to address that early. We see so many patients that are coming 1 year or 2 years, and that's a very, very difficult problem at that point. We're pleased to have an arthrofibrosis center. I might say that there's only about 4 or 5 or a handful in the United States. And we do see people from all over the United States. We have someone coming in from Hawaii, from Australia, if you can imagine, to get this type of treatment. For more information or to schedule an appointment, call 513-347-9999.